Talking about taking care of your heart in a segment sponsored by Stern Cardiovascular. Joining us now is one of their specialists, Dr. Reza Ahmadian. Thank you for joining us, doctor.
Hello, thank you for having me.
Okay, so what's considered cardiovascular disease in the realm of prevention?
Yeah, so we use the term atherosclerotic cardiovascular disease. It's kind of all-encompassing. Most of us, when we refer to this, we talk about a history of coronary artery disease, meaning a heart attack history, or blockages in the arteries that feed the heart muscle that can cause chest discomfort. But it is included within this realm also other diagnoses like blockages in the arteries called the carotid arteries that can, get blood flow to the brain. Also blockages in your aorta causing an aneurysm. We refer to this as like a triple A, you may have heard of. And then of course blockages even in the arteries of the legs that can cause cramping in the legs when people walk. So all of this kind of is within that diagnosis. And then we never want to exclude mini strokes called TIAs or full-blown strokes we call CVAs. So this is all in the realm of cardiovascular disease. And when we talk about both prevention, as well as those who already have the diagnosis, we need to consider all those features.
What were you going to say? Okay, so how do we determine who should go on statins for cholesterol and the blood pressure medicine?
So the purest way to determine who should be on a statin, there is a calculator that I often use. Now, I can't say that every physician uses it, but I will say that the cholesterol guidelines, for instance, really want us to use something called the pooled cohort equation, and it's these fancy calculator apps have it, and you can put it in, and it includes a lot of features like the patient's age, do they have diabetes, things like that, what's their total cholesterol and their good cholesterol, and it spits out a number. Basically, that number is your 10-year risk for a cardiac event, and so I plug those numbers in, and I get the number in 7.5% 10-year risk, puts you in what's called the intermediate risk zone. And usually that's kind of where I would say a statin of a certain dose called moderate intensity should be considered. If the number pops out 20% risk or greater, then definitely you want what's called a high intensity statin. And, we can delve more into what high intensity versus moderate intensity mean. But for our purposes, at 7.5% risk or greater, you should really consider a statin, especially if they have other risk modifiers we talk about, like a family history, ancestry matters. Like, for instance, those with South Asian ancestry are at higher risk for cardiac events. So we consider that, even though the calculator doesn't include that in its determination of risk. Things like that, your LDL cholesterol, the bad cholesterol, if it's consistently above 160. And then there's other risk markers that aren't included in a normal cholesterol panel. One is called your Lp(a), which is getting a lot of press lately, which can make you very high risk for events in the future. So if you have an elevated Lp(a), that should be considered in your determination of statin therapy. And then your other question was blood pressure, and believe it or not, we should use that same calculator if someone who has, no significant risk factors that you could tell just off of their personal history. You want to plug in that same calculator, and then again, if your 10-year risk is at least 10% or more, it determines your blood pressure goals. But statins don't help reduce blood pressure. You're using that calculator to determine who should be on pharmacotherapy medicines for their high blood pressure versus those you can just use lifestyle changes like diet and exercise and things like that instead.
And what are ways other than medications to reduce risk?
Right. So, we preach about the Mediterranean diet or a heart-healthy diet, a diet high in fruits and vegetables, whole grains. You really want to avoid processed meats like salamis and hot dogs and things like that. I know a lot of people watching are going to be very upset with that comment. If you're going to eat meat, I will say the American Heart Association really loves a plant-based diet, but they understand too that a lot of people do love consuming meat, and if you're going to eat meat, you want baked or grilled chicken or fish or turkey. Red meat should not be eaten often, rarely is fine, but you don't want it to be part of your usual everyday diet. And then, of course, avoiding a high carbohydrate diet, rice, potatoes, breads, fast food, sweetened drinks, sugary drinks, those kind of things. So that's in the realm of the diet piece. But then exercise, you want at least, the ACC has a guideline paper on this too, the American College of Cardiology, where they say at least 150 minutes of what's considered moderate exercise, which it would be walking, yoga, biking, and then, or you can do 75 minutes a week of vigorous exercise, which would be more like jogging, singles tennis, whatever, you enjoy doing. Pickleball now is a new thing, so you can include that in there too.
Love it. Thank you, Dr. Ahmadian. Great information. Thanks for taking time to join us, and thank you to Stern Cardiovascular for sponsoring today's segment.